Welcome to Modern Management of the Older Adult, brought to you by the Institute of Clinical Excellence.
Hi everyone, welcome to the MMOA podcast, brought to you by the Institute of Clinical Excellence. Today we are doing a patient interview with my patient Yvonne Boxerman, and she's going to tell you a little bit about her story of going through PT prior to her surgery, and she'll tell you more about that in a sec. But I am so excited to bring this to you guys because it gives us a lot of pretty much insight into how potent physical activity and strength training can be prior to going into surgery. So Yvonne can take it away.
Good morning, everyone. Thanks so much, Kay, for inviting me to come on. So let me just tell you briefly my little story about this is regarding cancer surgery. So last summer, at the end of last summer, I had a colonoscopy, and everybody, if you're supposed to get a colonoscopy, get it because it can save your life. After I had this colonoscopy, they said, we need you to come in, and unfortunately, we detected some cancer. So I had a colon surgery. Thank God everything went well. It was perfect. I didn't need chemo. They got it all. And they said 2 months later, we need you to come back and have an MRI or some kind of scan just to make sure those little things didn't go anywhere, you know, that we got everything. So 2 months later, I went in, and unfortunately, they did find something unusual in the pancreas. So here I am all done with colon cancer, and now I am facing pancreatic cancer. But because they did this scan, they got it early. And so they got it at stage 1, pancreatic cancer stage 1. But, that's not great news to get. So we have 3 married children, and our daughter's married to a doctor. And, of course, he wanted to know all the entire story. And he said to me in very stern tones, you have got to prepare yourself for pancreatic cancer surgery, which is known as Whipple surgery. It's pretty serious. It's like an 8-hour operation with a long recovery time. So, being a good mother-in-law, I listened to my son-in-law, and the next day there's a whole set of weights arrived on our porch. Amazon delivered them, which he had sent to me to start preparing myself for Whipple surgery. He really scared me. So then I thought, I'm not going to do very well myself doing this kind of stuff. I've never lifted weights. I don't know how to do this kind of thing. So I I sent a note to my primary care physician, and I said, I'd really love to get some help. I need to get physical therapy to help me get through this surgery. And she said, absolutely. Thank goodness, that's what she said. And thank goodness she sent me to Agile physical therapy, where I met the wonderful Kay, who's right sitting here next to me.
Too sweet.
She does all the pre and post surgical patients along with other things, but that's her expertise. So she provides all kinds of training to people who've just had surgery. So that's how I got to Agile.
Cool. And I think it's really cool that your son-in-law advocated for you, because a lot of the time they're like, oh, you're fine, you're nice and healthy, like you don't have to go through any sort of physical therapy or anything, like you'll do fine with surgery. But like you said, it's like a really intensive surgery, usually long recovery time. I think you told me it's at least like
up to 2 weeks in the hospital
and afterwards.
And usually another month at home.
Yeah, so it's really cool that your son-in-law led you to physical therapy, because some of the time we don't have a lot of people to advocate for us, especially for things pre-op. Like some people have to get ACL stuff done, and they go through pre-op because it's known pretty well in research that it'll help. But for things like surgery to remove cancer and stuff, research is still spotty on it, but you did a fantastic job in physical therapy. Can you tell them how much you were able to learn?
Yes. So I had no idea that Kay had a lot of faith and trust in me and probably all her other patients. I had never done weightlifting, I went to Zumba and I did that kind of exercise, but not anything like what they have you do. So she said, let's try the kettle weights. It looks like a kettle if you're not familiar with it. And they're all varying weights, starting somewhere around 18 pounds, all the way up to 62. So we started low, of course, and I was so proud of myself that I could lift 18 pounds. My goodness, I've never done anything like this. And Kay said, oh yeah, we're going to go the whole way down this line. My mouth dropped open and I said, are you kidding me? You think we can do this? She said, absolutely. And lo and behold, 3 days before I went in for Whipple surgery, which was on March 27th of this year, I lifted 62 pounds. And I did it a few times to the amazement. And I have it on tape because Kay filmed it on her camera. And otherwise I wouldn't believe it, and neither would anyone else, that I could have done this. And it's all because of her expertise, knowing how to build up. And I never experienced an inch of pain anywhere from the surgery, from the exercise at all, none. So then I went into the hospital for the surgery, and that was on March 27th. And I have to say that I was in a very good place mentally. And I think that's the other thing, that if anyone can be helped at all pre-surgery, it's to try to surround yourself with positivity as much as you can. People who are making you feel good, people who maybe send cards or bring over a meal, or family who are not just worried, sick about you, but also are providing good, positive feedback. So when I went into the hospital, I was not scared. I was in a good place. I did know that this pancreatic surgery was at stage 1, so I was, felt good that they could get it, which is not true of all pancreatic surgery, unfortunately. Usually the news is not so good. Anyway, I had the surgery, and at the risk of sounding a little bit immodest, I have to say that when the residents came around, this was at Stanford with the #1 Whipple surgeon in the West Coast. He was just amazing. But when they came around to do their rounds, I heard one of them say, and this is our star patient. And the only reason I got that title was because I had prepared myself with the help of Agile or any physical therapy group that you might be associated with, and especially with Kay, who knew exactly how to get me ready for this surgery. And after the surgery, I was up and out of there on the 4th morning. Instead of staying a week or 2, I stayed basically 3 full days and went home. And I had family members at home. Our kids live in different states, but each one came for a week. And my daughter was there, and my husband, of course, and just having that, being surrounded with love and help, if you have that option, and hopefully everybody does, it just makes a world of difference in your recovery.
Totally. So the physical therapy part, definitely important, but I think Yvonne is definitely touching on the importance of having a good support system. She's told me about a friend who would come, I think twice a week, right?
Yes. Twice
a week to also work out with her. So she got like 4 days a week of some kind of strength training and cardio to help her prepare for this surgery. But it's just having that great support system is so important for our patients, and just checking in with them to see if they have that, especially because there can be so much fear surrounding surgery and not knowing what to expect. So just talking to them about that will also be really helpful. What would you like to tell the audience about your experience with PT and surgery? Like, what do you think would help them kind of talk to their patients and everything?
Well, I think just getting someone to advocate for you, get this physical therapy when you need it. When you feel you need it or your doctor feels you need it, you should just go for it. Don't be afraid of it. I'd never had physical therapy before in my life, and I didn't know what to expect, and it was just so helpful. And in fact, I want to add that right now I'm undergoing chemo. I just had one round, and I have another one today, actually. I'm not afraid of the chemo.
Look how good she looks.
I still have my hair. They said it might go, but at the moment I still have it, luckily. So I think that if you can advocate for chemo after, I'm sorry, I keep saying chemo, for physical therapy, I have chemo on my mind, for physical therapy after surgery or after you've had your procedure done, it's very, very helpful because I've been, Kay actually sent me a podcast of a woman who said, you do so much better with chemo if you're exercising. And I really didn't have much of a reaction the first round. I don't know what will happen today with the second round, but just the idea that I'm not going to get the terrible reaction from chemo that usually happens because I'm exercising. I'm not sitting, I'm walking, and I'm coming to physical therapy a couple of times a week, and that all of that really helps. And if you can also keep your positive attitude during chemo, that will help you too. To recover and to get better. I'm sure of it.
Awesome. So, I think Yvonne touches on so many good points, like good support system, making sure you advocate or somebody advocates for your patients to get physical therapy when they're going through chemo as well. The podcast she's talking about, it was through the Active Life podcast, and it was with Helen Bealey. So shout out to her for sharing her experience with going through treatment for cancer and pretty much being a rock star and continuing to exercise through that as well, just like Yvonne here is doing. I think Yvonne is such a great role model because she let me push her. And sometimes patients will be afraid of getting to that limit. And sometimes they'll be like, well, I don't know if I can do that. But Yvonne's a rock star. And like pretty much at MMOA and Ice Physio, we always ask patients, like, how strong do you think we can get you? Because sometimes the limiting factor isn't necessarily like what they can actually do, but what their thoughts on what they can do. But somehow Yvonne trusted me with that. And she was able to lift so much. I think what's also cool is that was when she was in the hospital, she showed all the doctors and the residents her video of her lifting. And I think this is also a huge deal because it allows other members of or other healthcare providers to see what our patients are capable of and that they're not just fragile and like aren't capable of doing things. Because to function in life, we need to be able to lift and carry and do certain things to make sure we're still functional. And I think that shows them how much somebody can lift and do prior to surgery. And maybe this is a step in the future, or a step in the right direction for the future for surgeons and other people to send patients to physical therapy prior to surgery, because they can kick so much butt after surgery if they're stronger and have more functional reserve. Yeah, anything else you'd like to share?
If I could just add one thing to what Kay was just saying about that little video, I'm so grateful she took it, because I got a lot of use, or, I showed that video so many times. But when I was in the hospital and I decided the surgeon came on rounds with his whole team, and there was a very fit looking 25-year-old as part of this team. He looked to me 25 anyway. So I took out my phone. I said, hey, I got to show you guys this video. I'm lifting 62 pounds. And they all laughed and said, oh, sure. And then they saw the video and they said, wow. And this 25-year-old guy said, you know what? I couldn't do that. And that was the best thing I heard in the hospital the whole week. It was really funny.
It's so great. It's pretty much breaking our preconceived ideas of what patients or what anyone can do. Hopefully it motivates him to lift a little bit too.
Yeah, and I'm 76, so, that made me feel really good that day.
So, thank you everyone for joining us. And thank you, Yvonne, for sharing your story. I know sometimes it's not easy to do that, but I so appreciate that you are willing to do this with me and share it with all of these other physical therapists, occupational therapists, PTAs, and CODAs, or whoever else may be joining us, maybe even patients and their family members, because I think your perspective really, really helps us just realize what's important prior to getting surgery pretty much and having to go through things like chemo for cancer.
And thank you, Kay, for being there for me and for all your other patients.
Of course. All right, everyone, have a good Monday. I'll see you guys soon. Bye.
Bye.
Thank you for listening to the MMOA podcast. If you found this helpful, please share with someone that could benefit. And if you're looking for more practical content to help you better serve older adults, head over to www.mmoa.online, where you can learn more about our free resources, our community, continuing education courses, and our certification. Once again, that's www.mmoa.online. Thanks for listening.